Right. Good evening, everybody. Good evening. Thank you so much for joining us tonight. Just so you know, we are also casting on YouTube. So hopefully it's already live on YouTube. For those of you that don't know me, my name is Abimbola. Um, I work as a life coach, as a counselor, and today I've got a very special guest to speak on the webinar today, Dr. Abimbola Oyedokun. I was just telling her before signing everybody in. I'm really excited. I'm not the one speaking today. She's the one. So I just love to learn. Okay, so I'm going to be learning from a wealth of knowledge. And it's actually an honor to have you speak here today and to ask for you to even accept to come on your weekend to come and speak to us. I just wanted to say I really appreciate you and thank you. Thank you very, very much for coming. So I'm going to yield the mic to you. And if you could just, in short, before I yield my mic to you, let me hold it a little bit. Let me prepare you while it's still very hot. So if you know you're here today, how has your day been? If you can just drop in the comment section how your day is been. So find one word, one adjective to describe your day. My day has been very calm, excuse me. My day has been very calm. So mine is calm. So if you could drop in the chat as in what adjective will you use to describe your day? Engaging. Dr. Abimbola said our own it has been very engaging. That is good. And you're still going to engage us tonight. So if you could drop in the chat session, how has your day been? Use one word to describe it. I need more response, please. How has your day been? Let's see. Okay. How has your day been? Engaging, calm? So if you know it's chilled, Tilly said chilled. That's good. That is good. My day has been eventful. This actually said our day has been eventful. You know, the curiosity in me is trying to like ask you, what do you mean by eventful? What event took place? Do you want to share with us? You know, that curiosity is part of me. So if you don't mind, if you could just enlighten us a little bit, if it's okay, what has made your day very eventful? So, okay, so we've got eventful, we've got blessed earlier on. So I'm now ready to yield the mic to you, Dr. Abimbola. Thank you so much once again. So if you could introduce yourself and yeah, we can start. Others can join us as they come in. Thank you.
Okay, good evening, everybody. Can you hear me clearly?
Yeah, I can hear you loud and clear.
Yes, okay, thank you. Yes. So thank you very much, Abis or Sonia.
Just call me all. Abby and Sonia is fine. Or Abby or Sonia, whichever is fine.
All right. So thank you very much for having me on your platform this evening. It's an honor, and I say thank you. So let me introduce myself first before I start talking. So my name is Abimbola Oyedokun, but some people call me Abi, some people call me Bimbo. So I'm a consultant psychiatrist, and I work with the NHS. I work on the Wirral, and my area of specialty is child and adolescent mental health and psychiatry of intellectual disabilities. So I work with those who've got like, so I do generic CAMS, and I also do those who have got learning disabilities, both adults and children. And I also do a bit of neurodevelopmental disorders, so like autism, ADHD, and things like that. So it's a pleasure to be here, really. I believe my work, well, I don't call it as my work. I view it as my calling. And so every opportunity that I have, to talk to people, to educate people about, what I do and what it entails, it's always, I don't take it lightly. So this evening, I'm going to be talking about mental health And I'm glad that more and more the discussions about, mental health illness, mental health assessments is going on more, because I don't think we know a lot about it. I don't think we know enough. And in my day-to-day clinic and in my interactions with people, I come across, people who are not well informed. And because they're not well informed, they do not make the right choices. But I believe that the more information we have, the more education we have, the more knowledge we have, about these issues, the more we can openly talk about it, and the more we can take decisions, that can help us. And so I want to encourage everybody listening. Some of the things I might talk about today might not directly, be related to you, but I hope that we'll all be able to get, pick up something that we might be able to use to help other people. So the way I'm going to do it today, I'm going to do a bit of, it's just going to be more or less like a whistle stop through, through various topics that I have highlighted. And then I'll try as much as possible not to talk too much, but to leave time for questions, because I also believe that it's not just about me pouring information, but the way people would get get benefit from being on this platform is if they can also have answers to the questions that's on their mind. And I would say at this point, I'm not claiming that I can answer all your questions. I'll try my best, you see. And if there's a question I can't answer, I would ask for your permission to go and do my research, and then get back to Abis to give you back the information. But I'll try my best, within what the experience that I've had so far. Okay, so can I share my screen now? Yes, okay. So Sonia, I've got here, it says one participant can share at a time. Okay, I just click on that. Okay. Can you see my screen?
Not yet.
Not yet.
No.
Okay.
Did you just click on share screen? Oh yeah, it's coming up. It's coming up.
Yes.
Yeah. But it's showing as a slide. So if you could do like
yeah, so I'm trying to get it on, I'm trying to get it on slideshow now.
Okay.
Can you see it on slideshow?
I can, but it's starting from the end.
Oh.
Are you using Canva?
I don't know. You have told you now that's great. Now
don't worry, just yeah. No, you got it. You got it to the beginning. You got it to slide 1. So if you go back again.
Okay. Okay, let me try again.
It's already opened. If it's already
yes,
opened,
it's already opened. It's already
cool.
opened.
So you just click on share screen. If you click on share screen, or you can email it to me and I'll just quickly cast it for you. All right, it's coming. Yeah. Okay.
So can you see it now?
I can see someone's head.
Yes.
Oh, it's gone.
All right. So let's start. Please, I beg my apologies. I'm not an IT techie, so but I'll try my best to make sure I don't muddle up all the things that I have prepared. Okay. So if you can't see it at any point, just let me know. Okay. So this afternoon, or this evening rather, we're going to be discussing, about, so I've titled it, what is it about mental health? And I think this is because there's a lot of there's a lot of myth, and there's a lot of, when people hear mental health, people think, oh, are you telling me I'm crazy? You see. But I hope that by the end of, this discussion, we'll be able to gain something there. So the way I'm going to go through it, I'm just going to go an overview of what I'm going to do today is, have a definition of mental health, the definition of mental health illness. What are the signs of mental health illnesses in children and young people? Because I think we're going to kind of zero in on that today, and just a little bit about special needs. So when we talk about mental health, if you can see the diagram I've put there. So, just like we have physical health, we've also got our mental health. So our mental health, obviously our physical health is that part of when you talk about problems with your physical health, you're talking about your body, that you can see, that you can touch, you can feel. Then when we're talking about our mental health, we're really talking about that part of our health that is unseen. And I usually like to describe it as the think, feel, act cycle. So if you look at it, so we've got the behavior. So usually our behavior, the way we think would affect the way we feel, and the way we feel would affect our behavior. And these internal unseen parts of us kinds of affect the way we think about ourselves, the way we think about the future, the way we relate to other people. So our mental health really is that social, emotional, or psychological part of us that helps us to relate to other people, that helps us to make decisions, that helps us to deal with stress. So every one of us have got it, and the mental health is present in every stage of life. So a baby has got their own mental health, a child, a toddler, an adolescent, an adult, an elderly person. So it's all parts of us. So just as we have our physical health, again, we have our mental health. And just as children or young people can have, difficulties with their physical health, and adults can have difficulties with their physical health, in the same way, a child or a young person too can also have difficulties, with their mental health. So for example, someone would say, what do you mean mental health in a baby? So for example, that babies, okay, when they need their nappy changing, they're hungry, they're cold, the way they'll let us know is by crying. And another thing is, if the person, their caregiver is tense, and their caregiver is not usually tense, and their caregiver is tense at a point, the way you carry the baby would know that this person is not relaxed, even though they might not be able to, actually understand what is going on. And the same thing too with children too, that's when they see somebody who is new for the first time, and then they're not really sure, how do I approach this? And they run behind their mom or run behind their dad. So these are parts of, it's all about our emotional health. Okay. And I'd want us to know at this point that when anybody talks about mental health, the person is not saying there's anything wrong with you. Everybody has got their own mental health. And again, I said our mental health determines the way we handle stress, the way we deal with situations, the way we perceive things. Okay. Right. So like I said, it's present in every stage of life. It's that part of us that's intertwined with our behavior, our thoughts, and our feelings. And another thing I would like to point out is that our mental health has a way that it interacts with our physical health, you see. So obviously, if the physical health is fine, the mental health too, most times would be fine. Sometimes if the mental health is not exactly fine, it might have a telltale effect, on the physical health. And sometimes, depending on what the physical health illness is, it can have an impact on the mental health. So when we're talking about, I always like to let people know that our physical and our mental health are closely intertwined. Okay. So the next thing I want us to talk about is to look at some basic terms. So first of all, I want to talk about mental health difficulties. So just again, as I said, our mental health is that part of us that's unseen that affects the way we think, we feel, we act and behave. Sometimes we can have difficulties, you see, with our mental health. And these difficulties can occur from time to time. So they're not always there, but it could be maybe because there's, say, for example, maybe you're changing jobs, or a child is changing school, or maybe a parent is ill, or maybe the child has to move house, So from time to time, there can be mental health difficulties, and basically it means that there's an additional stress on the mental health. There's an additional stress that the mental health has to deal with that's more than what has always been there. But then these difficulties are not always there. So each one of us from time to time can have periods of mental health difficulties, and it's part of life. It's part of the way we learn, it's part of the way we learn. It's part of the way we build resilience. It's part of the way the nature has designed it that we build our character. However, when we talk about mental health illness, this is when these mental health difficulties are not just occurring from time to time, but they've now begun to affect, they're there almost constantly, and it's beginning to have like a negative impact on the function or the quality of life of a person. And mental health illness can affect both children, young people, adults, and even the elderly. So just, like I had said, that our mental health is always there all throughout, our lifetime. So also, if there's a mental health illness can affect almost anybody at any particular point in time. Now, I would like to point out here that most of the times when we have mental health illnesses in children and young people, you will find out that most of the time it always has to do with an event or something environmental, that has happened. Though I must also point out that sometimes mental health illnesses, can actually be passed down. It could be genetic. And so you find out that, say, for example, if a parent has got a mental health illness, the children are more predisposed to having a mental health illness. Though I must also point out that the fact that a parent, a mom or a dad has got a mental health illness does not automatically mean that the children would also have a mental health illness. So again, environmental factors do come into play. And I would say that mental health illnesses should be diagnosed by a health professional. A lot of times you hear people talk and they'll be like, oh, I'm so depressed. Or they talk and they say this person has got bipolar. Or they say this person is, that person is manic. Or they say that person is psychotic. Obviously, with the use of internet and with the media, we see a lot of things, we hear a lot of things. So a lot of these terminologies get bounced about, But I would say that it is important to note that a mental health illness should be diagnosed by a health professional. And when I say a health professional here, I'm talking about either your GP or a psychiatrist or any medical doctor or a psychologist, who is qualified to make these diagnoses. So we need to be very careful when we use these words. And like we all know as grown-ups, the words we use kind of rub off on the children around us or the young people around us. And so sometimes in my clinic, without even having done any diagnosis at all, the young person is saying, I'm depressed. I think I've got bipolar. I think I might be schizophrenic, and that's because of the words they've heard about. But I would like to say, I'll stress it again, that a mental health illness should be diagnosed by a health professional. Okay, so now I'm zeroing into children and young people now. But sometimes you find out that what I'm going to talk about now can also apply to adults too. Okay, So what are the telltale signs in a young person or in a child to show that they've got a mental health illness and that the mental health difficulties, have gotten to the point where it's not just occurring from time to time, but it's now there all the time? And I would say change. If you don't take anything out from today, I would want you to remember that the telltale signs in a young person or in a young person or in a child or even an adult that would highlight or begin to prick your mind about a mental health illness is change. Now, when I say change, what do I mean by that? Change can be in any area. And it is also important to know that for you to note a change, you must have also been able to understand and identify what the normal is. So change can be change in eating habits. Is the child or young person eating more or not eating as much as they used to? Sleep. Are they sleeping more or not sleeping as long as they used to? Or are having broken sleep, not sleeping well through the night, or always complaining of being tired, which was not what would have usually occurred? Is this young person or the child withdrawing? Say, for example, you pick up your child from school and the child can't just wait once they enter into the car, or you're walking home or going on the bus or on the train. They can't wait, to tell you about the idea, and they're just spilling everything over, And though obviously I must also say that for some especially young people, the usual answer is nothing. So what happened in school today? Nothing. What did you do in school today? Nothing. So, did anything good happen in school today? Nothing. Obviously, so that's their default answer. And I'll tell my children. So sometimes I tell my son, and I'm like, oh, I didn't know they teach nothing in school now. And it's like, come on, mommy. And obviously that's the way you begin to, get things out of them. But a child, or a young person who's always very eager to talk about what's been going on, and then all of a sudden they're not talking again, they're withdrawing, they're not having that communication or interaction with you, or they're spending so much time in their room or constantly on the phone, and you want to look at what's going on the phone, and they're like trying to cover it from you, and they're not as open as they used to be. So that's another thing we need to look out for. So I've talked about sleep, I've talked about appetite, I've talked about withdrawing. Activities. A child who enjoys playing the computer game or going for sports, going swimming, going bike riding, and suddenly it's like, no, I'm not interested. I don't want to go. I don't want to go. It makes you begin to think, is something going on here? You see. Another thing we can also that can also point to signs of a mental health illness in a young person or in a child is if they keep telling you they're looking for excuses for not going to school. Today is tummy ache, tomorrow is headache, the day after it's backache. Or they come and tell you, during sports, I hit my leg or I banged my arm, and I don't think I'll be able to really write, that kind of a thing. You see? So it's always very important to note these changes. And like I said, for you to be able to note a change, you must know what is normal, you see, in the child. For some young people, you find that depending on the type of illness, it's mental health illness that it is, they might also begin to secretly self-harm. And you just suddenly stumble upon it and you're like, what's going on here? So one of the ways young people would hide when they're self-harming is suddenly a child or young person who would always like to wear short sleeve now begins to always want something long. They always have their jumper on, or they don't want to take their blazers off, or they don't want to undress in front of you, or they always, they want their privacy much more than is normal. So sometimes that could be a sign, you see, that could be a sign that something is going on. Or maybe even, like during warm weather, they constantly want to wear a sweaty or a hoodie. And that's because most probably the young person is hiding something. And it's important to note about self-harm, because now we're finding that even young children as young as 6, 7 are learning these things, you see. And there's one school of thought is that it's because there's so much awareness and presence of this on the media, you see. So we also have to be very careful what our children, you see, are exposed to. Another thing is, maybe like especially the young person, not being able to, not telling you the truth, not coming out about where they've been, where they're going, how they're spending their time, or who they are talking to, just being secretive. So it's always very important, for us to note these changes. So like I said, it could be change in anything. But if you know your child, or if you know the young person that is in your care, or the child or the young person very well, you will be able to pick up that, I think something is amiss here. Okay. So when you begin to note these changes, what do we do? How do we help? How can the parents help? Or how can the caregiver help? So like I said, in the first instance, be very observant. So if you don't know what the normal is, you'll not be able to know what the abnormal is, you see. So it's important that we're very, that our eyes and our ears are open, and we're very observant. And the next thing is very important too, that we're patient and show love. And I'm putting this here because I know most of us listening to this might be from an African background. And we are I'm talking to you, you're not listening to me, and the way we go on and on and on about it. And then the young person wants to talk, but even the fact that I'm talking to you, you're not listening to me, you're not telling me, why are you not doing this, We need to be patient and show love. Sometimes you find out that even this young person or the child, what they're going through is much more than they can even comprehend or understand. But if they know that, I can speak to my mom, I can speak to my dad, I can speak to my aunts, they'll be very open. And like I tell people in mental health, those of us who are mental health professionals, we don't have a blood test, or we don't have a blood test to be able to know what's going on exactly in the mind of the person. I can use my stethoscope to listen to the heartbeat, but I can't use my stethoscope to know what is going on in the heart of the person, or what is going on in the brain of the person. The way the person will help me to know what's going on is they open up and talk to me. And if a person decides they're going to keep quiet, or they're going to shut down, like we use for our young people, then it's difficult getting anything out of, them. And the young person would only open up about what is really troubling him or her when he or she knows that I can trust the person I'm speaking with. You see, so we need to be patient. We need to show love, even as much as we're really tight up inside that, he's not talking to me, she's not talking to me. But let's be patient and show love. And it comes with time. And I also think that even as parents, the more you can build a relationship with your children and help them to know that you're always there for them, when they go through these difficulties, it will be easier for them, you see, to speak up. Okay. I would say seek help as soon as you can. If you begin to think that something is amiss here, something is going wrong here, and I've tried and I don't know how to deal with it, please seek help from the GP, ask in school, ask the siblings, ask other people around that maybe are friends with this child or with this young person, or who get to see them, or who know them. And it's more like you're fact finding, not because you want to not because you're being nosy, but in a way to find out if other people too have seen these changes that you're seeing. So like I said, you ask questions, try and talk to the child or to the young person. It might not, the child or the young person might not come out immediately, but give them time, give them space. And that's where being patient and showing love comes in. Talk to the school, talk to the school, talk to the teachers, talk to anybody that can give you information in school, talk to the siblings as much as possible. A lot of the times for us mental health professionals, another very key source of information is what we call a collateral history, and that's a history from somebody else, who knows this person. So even you as a parent, you can also do that. And I would say be open to professional opinions. And when I talk about open to professional opinions, I've discovered that in my experience, when there are concerns, and say maybe it's the health visitor or the teacher in nursery or in preschool or in the junior school, or maybe the form head, someone is saying, oh, I think there's something here. A lot of us, especially those of us from African backgrounds, we're quick to have another explanation, for what is going on. And I know for some people, because of their faith, because of their belief, they're like, no, it can't happen to my child, that kind of a thing. But I would say be open to professional opinions. The earlier a mental health illness is detected and identified, the better the chances of recovery, before it gets worse. So the better the chances of recovery. And on that note, I would say, engage your faith. Engage your faith. Engage your faith. However, engage your faith wisely. And why am I saying engage your faith? So there's some things we can't, there's some things that you just can't explain. So if you think, yes, maybe whatever your faith is, and you believe that the God that you serve can help you, then definitely, definitely you can engage your faith in that. You can engage your faith in that area. However, I'm saying it again, that's in a wise manner. And I'm saying it again in a wise manner, that so that it wouldn't be, oh, I don't want medical help, I don't want professional help. This is what I believe in, and this is what I'm going to do. And on the other hand, there's more and more research that's coming up now to show that people who have got a faith, can handle mental health challenges better. They have a quicker recovery to mental health illnesses. However, again, I would say let's do it wisely. And I'll say let's do it wisely in the sense that don't let us always think, oh, it's like a spiritual attack or something. So let's be wise, let's balance it. Let's be wise. But I'll say it again, very importantly, we've learned that we're coming to know now in psychiatry that people who have a faith, they manage they recover better. They have a better, prognosis. And it's also shown that people who have a faith too, is a kind of protection around their mental health. Because let's face it, we all go through situations, in life that is too much for us. There's a limit to which a human being, can bear or can tolerate. And so it's the same thing too with children and young people. Okay, so that's another way in which we can help. Right, so let's move on now. I'm going to talk very briefly now on special needs. Okay, so when we talk about special needs, we're talking about the group of young people, children or adults who would need extra support, possibly maybe with education, with learning, with living, with day-to-day functioning. Okay, so those are what we call special needs. And special needs in the sense that the need or the service that has been that's made available for everybody cannot meet the needs of this person, of this child, of this young person, or of these adults. And so that's where the special needs term come from. So special needs can mean different things for different people. For some people, it might be a learning need. You see, it might be that they have problems with, probably maybe like with writing or spelling, and that's where we have conditions like dyslexia, or it could be things like dyscalculia. So dyscalculia is talking about when a young person or a child or an adult has problems with numbers such that it affects, the way they can understand mathematics. So people like this, would always have supports in schools, just an extra support. And it doesn't mean that the person with the learning needs would forever need, always have that learning needs. We found out that for quite a number of young people, they go on, to catch up, and they don't actually need this help later on. When it gets to a particular stage of life, it might just be maybe at the beginning, you see, or it could be with writing, with spelling, with emotional, we're helping to meet their emotional needs. Okay, so the next one I'll talk about under special needs is what we call the global developmental delays, or intellectual disabilities. So for some people with global developmental delays, this means when there's a significant delay for a child under 5 reaching specific milestones. Say, for example, maybe speaking, walking, toilet training. And we say there's a significant delay because the child hasn't yet achieved this milestone because of, we're not sure why, but compared to their age mates at that stage, we feel that, okay, this child or this young person isn't hitting that milestone as we expect at this particular age. And for some people, it might get to the point, it might also extend to having what we call intellectual disabilities. When these delays in reaching these milestones now affects, their ability to learn, their ability to function, their ability to have social interactions. Now, for some children who have got global developmental delays, after a while, they do catch up, you see, with their other peers. And later on in life, this delay might not have any impact. For some people, the delay might have a mild impact on their life. For some, it might be moderate. So for some, it might be severe. So it comes in stages. And usually the global developmental delays or intellectual disabilities, most times is usually picked up before a child is 5. Though, having said that, I must also say that for some people with intellectual disabilities, it might not be picked up, especially if it is mild. It might not be picked up until the young person probably maybe is getting to the secondary school age, or sometimes even college, you see. The cracks will now begin to show when you realize a 16-year-old is not, a 16-year-old can't manage money or make decisions the way you'd expect a normal 16-year-old to, and then you begin to suspect what's going on here, So for some people, the reason is always because when a child is born, most times the mom or the dad, especially the mom or the caregiver, they'll be able to identify that, oh, I think this child has got a challenge in this area. And most times they kind of build a scaffolding around them to make sure that, okay, if you're finding it difficult, if you can't pick up your pair of socks, it's difficult for you to identify a matching pair, I would always pick them and set them out for you and just put it by the side, you see. So those are some of the things I would do to kind of scaffold them. And you find that it might take until later, when there's more demands, before it now begins to show that, oh, there's actually something going on here. For some people with special needs, it could be physical health disabilities, maybe because of one form of illness, physical illness or the other. You find out that maybe the child or the young person needs to have a peg inserted, or needs to be on the wheelchair, or needs to be on a special type of mobility, mobility device. Now, for those with physical health disabilities, most times, their cognitive and intellectual function is still there. It's just that because of their physical health disabilities, it might not be easy for them to access services, you see, that other people without the disability would access. So emotional difficulties. This is when you find out that a young person is just not, is just finding it difficult to regulate their emotions. They can't tolerate no, they can't tolerate being with other people. They're not interacting with their peers or with adults the way you would expect them to. They find sitting in the classroom setting very difficult. They find having authority over them difficult. They can become aggressive, shout out, throw tantrums, hit out, be disruptive, you see. So sometimes when young people fall into this category, you begin to think, okay, it seems that we might need to put in some extra support, for these young person. And I'd also want to talk about the emotional difficulties. I just think that this is where we also have issues like maybe feeling low in mood, feeling anxious, not wanting to go to school, you see, can also come to play. And some of the signs of emotional difficulties, especially with young people, they'll talk about, that's when you now find it difficult. I mean, the young person doesn't want to go to school. They're feeling anxious. They don't want to go to school. They don't want to go out. They don't want to interact with others. They find friendships difficult. So another part of special needs includes the neurodevelopmental conditions. And these are conditions like autism, attention deficit hyperactivity disorder, tics, developmental coordination disorder, So these neurodevelopmental conditions actually occurs as a result of, the way I would explain it is the way the brain has been wired. And so it makes the young person or the child see the world in a very different way, or interpret the world or stimulus around them, in a different way. Because it's different to what is normally accepted. Okay, now, so what's the support process? What goes on? How do we're talking about all these things, for some people it might be, what exactly are you talking about? How do we even get to know that something is actually going on? Who helps us? Who is out there? What support do I have? So first and foremost, all these would start with an assessment and diagnosis. And that's why I said earlier on, let's be open to health professionals, and let's seek help on time as soon as we begin to see that there's something going on. So you can talk to your GP, you can talk to, if the child is not yet in school, you can talk to the health visitor. If the child is in nursery, you can talk to the staff in nursery, you can talk to their teachers. And as need and usually you find out that you have, if you go through the GP or through the health visitor, or even through the school nurse, you see, a referral can be made either to pediatrics, or usually the first point of call will be through pediatrics. So it's when, especially now when the young person is having emotional difficulties and mental health illnesses, that is accompanying maybe the behavioral and emotional difficulties, and they now refer on to CAMS. And CAMS is Child and Adolescent Mental Health Services. And most areas would have CAMS. Some other areas call it different things, but usually when we talk about CAMS, we're talking about the Child and Adolescent Mental Health Service, and it's usually from age 0 to 18. Some CAMS would go up to 19. Now we're trying to make, there's a move to let the services go to reach as high as 25, at the age of 25. And I know the same thing also applies in pediatrics. So sometimes their services is up to the age of 18, but sometimes some of their services go, above the age of above the age of 18. So other health professionals that can also help with the assessment and diagnosis would include educational psychologists, health visitors, social workers. Most social workers are trained, you see, to be able to pick these things up, especially from the early age. Especially from the early age, and they can also be very helpful, you see, in making referrals to the right quarters. And I'll say at this point that when we hear social workers, they're not, some people's idea of a social worker is they're there to come and take my child from me. No, that's not what a social worker does. A social worker is actually, just like it says, social, the social part of our well-being, you know, the social part of our living. They're there to help us to make sure that, you know, it's fine and that we're given the support when it's needed, and if they have it, you know. So another thing is, another support process is the school. So you could have educational support. So I'm sure some of us will know about, in some of our children's schools or young people's schools, they will have some pupils might have a TA, you know, with them, or a one-to-one with them. So sometimes, you know, this educational support is needed. The school would identify it, you know, and they would give the support. And then they'll give the support. Another one is the additional needs. So now, sometimes the support that is given by school might feel this support is not exactly enough, because what this young person or this child is dealing with is not just in school alone, you see, but it spills over into their social life, it spills over into home. And we're thinking, oh, they might need more help with that. And that's where we have the additional needs, where we have the health education care plan. So in this case now, it involves school, it involves social workers, and most of the time, for those of us, for some, I've had some of my patients also, you know, that that need an EHCP, and I'll be contacted to give my own view, you know, on what I think is important. So, for example, it may be that a child, especially who has got probably maybe intellectual disabilities, you know, needs a mainstream school. And apart from a mainstream school, they might need respite. And sometimes my giving an opinion that, look, respite is going to help the parents, you know, to give them a break, and also for the young person to also get a break. This is important. So all these things come into place. So when we do the EHCP, the EHCP is a plan where health, social services, education, you know, all comes together and make a decision and look at the needs of the young person and decide this is what's going to be the best help, you know, that we can give to this young person or to this child. And most young people or children who have the EHCP, it takes them up to the age of 25, and anybody can actually apply for the EHCP. So the EHCP is the request for the EHCP goes to your local council, wherever it is that you are, and a school nurse, a health visitor, the teachers, parents, you see, a mental health professional can actually ask, or a social worker can ask for the EHCP. There's quite a lot of process that goes on to it, but if you go onto your local council websites, all these things are there. And then you'd also, so that's where you'll also find information about the special education needs, or in some schools, they have what we call the SENCO, the Special Education Needs Coordinator. So if you go onto your local council on their websites, all the information that you would need to make this application, if you think you need to make the application, is there. And sometimes if you make the application and they deny it, you have the right to appeal, you see, against these decisions. And if you have it, and even if you think the decision is still not favorable for you as your local council authority, you can actually get it onto an EHCP, like a tribunal, you see. So there's the thing is, at the moment, social services would agree with me that our resources are stretched. But then I would always say, if you need help and you know you need help and you know this is where you can get help from, it might take a while, it might take long, but don't keep quiet and keep pushing. I'm not saying be aggressive, you know, but I would say be assertive, you know, and get your information, right, because truly, really, resources are tight. And so it's only when the local authority knows that, okay, there's no other way in which we can do it, we just have to give this family, we have to help them, you know, to support them. then we get the support. Though ideally it shouldn't be like that. We shouldn't have to like fight and go to tribunal, and it's all because resources are tight. But then you're able to to appeal these decisions. Okay, I think I've talked. So in conclusion, I think at this point, I want my conclusion to be questions, or any comments. I know I've said a lot, and I know some of the things might have raised some, some, maybe they're like, I'm not really clear about these, So, okay, so this is the time for, I think at this point, yes, I'll just take questions and comments. Yeah.
Thank you very much, Dr. Abimbola. Thank you. That was very, very, very informative. And yeah, thank you very much for that. So please, I want you both to just appreciate Dr. Abimbola, for our time. This is supposed to be weekend with our family. She's here with us, and she has shared a lot, giving us loads of information today. So if you could just appreciate in the chat, send our appreciation. And also, if you've got questions, this is the time. If you don't want your question to be made public in terms of this chat room, you can just click on, instead of to everyone, send it to me directly. I want to see more appreciation because thank you so much, Dr. Abimbola. That was really, really extensive. Thank you. People are telling you thank you. In the chat, we've got loads of people in this room. So if you could just send your appreciation by typing it, that would be really good. Someone said, thanks, Ma. We appreciate you. Thank you so much, Doc. We are grateful, very informative. Thanks a lot, very insightful. Obi said, thank you very, very much. While the thank yous are coming in, I really appreciate your questions. I always tell people knowledge is very, very good. It's powerful, but when you understand it and know how to apply it, then it's even better, right? So if you know you need it, if you want to see Dr. Abimbola, you will pay. You will pay. You will join the queue. If you are going through the NHS, you will pay. So please, everybody say thank you so much. Send your questions. Before more questions come in, I have a question here. So for example, for people that are new to actually it's 2 in 1. So the first one, you talk about change being a big factor for children to trigger things like that. A lot of people have just immigrated into the country. There is high influx of people from Nigeria, Zimbabwe, Ghana, different people coming in. Some of them are health professionals. They might not necessarily be doctors, but different aspects. So would you say these changes could trigger mental health, especially if the child, even work in schools, I know that sometimes children can be so hard on each other, what they don't know. But sometimes they don't mean it. Their curiosity can be overwhelming for some people. Could you say that could, impact on a child's mental health? And if so, what is the best way that a parent could address that? I will let you answer that before I move on to the next question.
Yes, thank you. Thank you, Sonia. That's a very important question. And like you said, I'm also seeing more and more of it. And I would say that, first of all, especially when you're coming into this country and the child or the children or the child you're bringing in with you are older than 5, you see, it's a change, because already by the age of 5, you expect a child to be able to, they've developed their own accent. They've developed their own accent. They can talk, they can say their names, probably maybe write their names, probably maybe read. And especially for those of us who are coming from the Nigerian setting, we're so very eager to make our children, and other African settings, to make our children to begin to read and to talk and to, so most of our children will come in and have that vibrancy. And, because of the way we are and the way we talk, our children can be very forward, and then they come into this system, and the system here is very different. You see, the system here is very different. The way we learn, the way children learn here is very different. You know, so it might be a shock to their system. So especially when the child is about 5, you know, they're kind of set in their ways. So yes, it can be that change. It can be, you know, it can be a shock to their system, and not just going to school, but also coming into a new place with a new weather. They're not, especially for those maybe who have not even been out of the country, out of Nigeria or other African countries where they're coming from is before, you know, the cold enough, even for an adult, the cold enough is enough to like, my God, is this, I know they said it was cold, but it wasn't like, you know, it wasn't like this. So I think one of the things that we can do is always very good to, you know, to have a foreknowledge of where you're going to, of what's going to happen. In hindsight now, you say, I'm trying to find the right words to use. I would say that, you know, if we can kind of rewind the clock back, it will be a good thing. Before the child or the young people come in here, let them know where they're going. Let them know if there's going to be, if you've already been able to identify a school where they would live, if you can get pictures, if you can have an idea, let them know what the weather is. Let them understand that there's 4 seasons. Let them understand that you dress according to the weather. Let them understand that the accent is very different. You see, because that's one of the things, again, our children coming in here, because they've come in with their different accents, the young people here are kind of, and children can be mean, let's be frank. I've seen situations in my clinic and they're like, you mean? Children can be mean, you see, and they can also kind of, and sometimes they pick it up from their parents because of the kind of the loose and casual words parents would use. So, you know, it's letting the child know where they're going into the school, having a picture, having a good idea. Let them read, you see. Most of our children they're also IT, they can go on the internet and find out information. And another thing is begin to build their resilience. Because the truth is, somehow, no matter how, you know, how well you prepare a child, you can never prepare the child for every single situation that would occur in school. But let them be prepared. Let them know that sometimes they might get into a class where they might be the only colored person, or they might be the second colored person, you see. But let them know that it's fine. It's fine. And I think let them be able to build their self-confidence, you see, and let them have the opportunity to open up and talk to you as a parent. And I think it's also important for us parents to find out too about where they're going into. And usually, and I would say, and especially if you know there are 1 or 2 people that have gone ahead of you, it's better to, you don't have to learn from your own experience. You can learn from somebody's experience and not make the mistake. And I think, again, I know a lot of us coming into this country and you want to work, you want to make money, you want a better life for yourself, you want a better life for your children. But we also need to take into consideration that as much as we're putting effort into our work and into making money, we also need to put effort into making sure that our children are emotionally balanced, and then we have time to, you see, for them. And children are still growing. So even if the child is over 5, as long as the home environment is stable and consistent and there is love, the child will thrive, even though it might be wobbly, you see, at the beginning. But with the right support, the child will thrive. And most schools now, especially now in the days of equality and diversity and inclusion, I mean, you go into school, if you think your child might find it a bit difficult to settle, go into school and talk to school. Most schools now would know, you know, most schools now have what we call a kind of mental health. Some of the teachers, they are already trained, you know, like in what would I call like first aid, mental health first aid. So go into the school and talk to their teachers. I talk to parents, especially parents from African backgrounds. They're telling me their child is like this at home, is like that at home. And I'm like, what's going on in school? And then they're like, I don't really know. Most of the time, somebody else helped me to pick them up from school. And I'm like, what about the parents-teacher day? By the time I come back, by the time my shift finishes, the time for that is over. And I'm like, look, that's another thing which I'm sure Sonia has been addressing on her own, on this platform. We need to understand how this educational system is, because if you don't know what's going on, if you don't know what the system is like, you won't even know where to begin to, help your child. So I would say for those of us who are here now with our children, let's be open, encourage them to be open to you. Let them tell you what their difficulties are, and try and see if you can actually go into school, and find out what those difficulties are. And also let our children know that they're coming into a different environment, you see. Even for those of us who gave birth to our children here, sometimes they would come home and tell you that somebody said I'm brown skinned, somebody said I'm black skinned, you see, somebody said my hair is coily, and my explanation is like, look, you didn't create yourself, okay? You didn't create yourself. You didn't choose who you would be, but you've been created and chosen for a purpose, and you're unique, and nobody can be who you are. And one thing again that I know is that most of our children are, if the environment is right for them, they excel and they thrive. So I think we parents need to put in a bit of, more effort, especially in these environments. You need to put in more effort just to go the extra mile to be sure that, yes, I'm safeguarding my child's emotional and mental health. Yeah.
Thank you very much. I've told people before that you don't just bring children here. That's a major change. And some people like, their children have big mouths, so they don't want anybody knowing they are jackbuying out of the country. If you're not Nigerian, it means you're traveling out of the country. You don't want people to know the secrecy and everything. Then you have to find another way of doing it, one way or the other, because if you're saying your child cannot keep their mouth shut, that is another problem on its own that you need to address, rather than keep everything secret and then the changes topple them over and we are dealing with different issues. And you're right about schools. We have counselors. I do counseling in school, and these children are assessed and everything. Yeah. Sometimes some parents are not cooperative because you think because your child is going to counseling, they are not mad. They are not mad.
Yes.
Just cooperate. Exactly. For crying out loud, they are not mad. And nobody's trying to take your child away from you. They are just trying to help them if they go through the right thing. I'm not saying school system or school staff are perfect. At the end of the day, the system is there to help each and every one of us. Then how the people that are now working with the system deliver what the system says is another story. So I'm not going to comment on that. Thank you very much, Dr. Abimbola. I have another question. He said, if someone is new to the country and they have a special needs child or a child that is challenged, they don't have the assessment, because you need the educational plan for you to be able to get into school. Peradventure, you don't have that. And what you have maybe just be a little bit of assessment from your home country. How do you actually kickstart the system here? And if you have kickstart the system, if it's getting slow, what are the steps that one could take as a parent?
So I would say, first of all, if you already have a form of, a statement or, some documentation that you've brought with you, go to the GP, 1. Now, 2, go to the GP and let the GP know. If you think the GP would assess, if there's a need to refer to the pediatricians, they would refer, depending on the age of the child. If it's in a nursery, so if the child is in nursery stage, so now in at least in England, that I know, most of the people who help to take care of the children in nurseries are trained to a particular level, and they all use what we call the early years foundation curriculum. So speak to them, and they would also be able to help you to say, okay, this is where you need to go to. And it might also be that the child, depending on the age of the child again, that they might need a health visitors review. So if you go to these in different areas, we have children's centers and you have health visitors who attend these children's centers from time to time on a particular day at a particular time. You can actually walk up to them and talk to them, you know, and ask for advice. And if you think your child needs an EHCP plan, an EHCP, you can, like I said earlier, you can make an application for it by going through your local authority, and I think through the council. And if I have my facts correctly, I think they should respond to you within 16 weeks or thereabouts. And if after that you should be able to call them and say, I've done this and I've not gotten any reply back. And like I said, sometimes you can appeal the decisions. Now, on the other hand, again, I think we also need to be clear on, you know, the status in which we come in. So I don't know what people's status are. Sometimes, you know, I'm not very clear about that area, but I think it's also important to know what has been, you know, what you're accessible to. Though, having said that, in this country, any child there's still some, under the Children's Act, there's still some services that a child should be able to get access to, regardless of their immigration status. So I would say GP, look for the child center that's near to you, and look for, you know, get to talk with one of the health visitors, call up the local council, you see. So if you call up the local council, and if there's a need for an educational psychologist, they would help you to go about it. It might take a while, but just keep pushing. And besides, every child who comes into this country must have at least a primary and education, and I think secondary education. And so obviously, so because of that, you don't really pay, except you want your child to go to a private school. And it is also the right of the child to be placed in a school that is going to meet his or her needs. So GP, seek out the health visitor, local council, you know, if there's a need to be referred to a pediatrician. Yeah.
Thank you very, very much. I've got a few more questions. It said African parents shy away from seeking help for mental health issues due to fear of medications. Is this fear unfounded?
Well, it's, first of all, I would like to say that most mental health illnesses for a young person or a child, as I said earlier, most of them, the root is environmental. And so when we see young people or children, I'll speak on behalf of child psychiatrists now. Usually medication is the last resort. So me, for one, the team I work with know that for you to get me to prescribe, okay, you'd really try, because I don't, as far as I'm concerned, if a medication is not necessary for a child, you see, then don't prescribe. Because I say to parents, medications, they are not Haribo, they are not sweets, they have side effects. And when you put a child on the medication, it is difficult to take the child off the medication. So like I said, I work with both children and adults with intellectual disabilities. And I have a lot of patients in adults intellectual disabilities that have been put on medications since right they were young. And it's been difficult taking them off, because they've not kind of gotten used to it. So when a child comes in with a mental health illness, usually, in fact, in most services, the first port of call is not a psychiatrist. The first port of call is what we call clinicians, who would do an assessment and who would offer therapies. So, and the nice guidelines that guides our practice would say for most illnesses, most conditions, you'd have to carry out a psychological therapy, look at the environment, what can be changed in school, what can be changed at home, what other support, does this child need some psychological work in building their self-confidence, in making sure they're eating better, in building their self-esteem, in helping to improve their mood, and things like that, in helping to stop self-harming before we get to the point of medication. But having said that, there's sometimes when we see some young people and we think from our assessments that what they need is medication. And that is not something we take lightly. So what we usually do is, before you give your child medication, you give her what we help parents to make an informed consent. So you have an information leaflet, you see, about the medication. You ask questions, you go and make your own reading, you go and do your own research, and then it's an agreement. And most times when we start on medication, we say it's a trial. You use it for a period. If you don't think it's effective, we stop it, you see, and we monitor it. So sometimes, most times, we don't start with medication. However, if the young person comes in, or the child, and we think there's a need for medication, if it's severe, then yes, we would prescribe medication. But always is with monitoring, and it's not a decision we take just lightly like that. So don't be afraid. Don't be afraid. And you can ask questions. You see, you can ask questions, and you're not forced, you see, to make a decision. We as much as possible, we try to deliver what we call patient-centered care, and taking in the views of the parents or the carers. And this is part of what a child has rights under the Children's Act. So I would say don't be afraid. No, it's not always about medication. You can even take, and if they say medication, you can ask that, okay, is there not something else we can try? Can we wait a while? You see, I think a lot of us come from a background where those are kind of in authority, you take everything they say hook, line, and sinker. I'm not saying be aggressive, I'm not saying be argumentative, but I'm saying you have a right to ask questions, and not to be rushed to make a decision.
Thank you very much. So most African parents feel shame and end up not getting the help they need. Is assessment and help available to all, irrespective of their immigration status or color? I think you've touched on this before.
Yeah. For a child, for a child coming into this country, every child that comes into this country is bound by the Children's Act. There's also the Human Acts, the Human Rights Acts, you see. So there's always a way. I'm not saying become a lawyer, but what I'm saying is that there's a way in which you can argue your case. And besides, especially for children and young people under the age of 18, I don't think they will be denied any form of care, you see, in this country based on the status, of their parents. Now, so that's the health. It might be that maybe they might not be able to claim one form of benefit or the other, you see, but at least the point of having access to health and having access to education, I don't think it should be denied. I haven't heard of a case so far, so I wouldn't say I know everything. I haven't heard of a case, that has been denied based on, their color or their immigration status. No, in fact, I've heard of parents who have actually relocated because of one of their children having special needs, and they've gotten the help. You see that they want.
Thank you. Right. You mentioned that help sought may not be permanent or for long term. How can a parent know that they will not be labored on the child and will not be used to stunt their development? I ask this because the fear of having a permanent labor on a child, just trying to scroll, on a child discourages parents from seeking help, and more particularly from a place of distrust of the system. How can this be gauged and avoid also labeling the parents as living in denial?
That's quite a tricky one. I would say, so first of all, before we give a diagnosis, again, I'll say most child psychiatrists, before you give a diagnosis, it takes a while. So sometimes I would rather group everything under emotional difficulties, emotional and behavioral difficulties, you see. However, if there's a clear-cut pattern of depression, then you give it depression. If there's a clear-cut pattern of anxiety, then you give it anxiety. If there's a clear-cut pattern of a psychotic illness, and if you note my presentation, I didn't put any mental health illness. I didn't talk about specific mental health illnesses, that's because most times I usually would not want to view a young person, you see, with a diagnosis, because once you give a diagnosis, now the diagnosis stays with the young person or with the child. It might get to the point of sometimes you might say the depression is in remission, and it would always be on the records of the young person or the child. You go back to their GP records, because everything we do, we would always copy the GP. So the GP would always, get to know about it. However, I want to also say that sometimes, in most times, these conditions are noted, identified on time, and are treated. There are conditions that can be, that can be maintained, you see. And I would say that we should not be afraid of I don't like the word label, you see, because when you say label, it's almost like as if whether you want it or not, I'm sticking this on you, and this is what you are going to be carrying about. No, don't let us look at it that way. Let's we can have meaningful discussions with the health professionals. And like I said, so for example, like the global developmental delay, for some young people, after a while, you find out that they catch up. And yes, it's there in the history, but it's not what is having an impact now, on their currently in their life. So don't let's be afraid, and don't let us think about it as a label. If a young person or a child needs help, needs assessment, let us go with an open mind, And if you get there and the health professional says, this is what I think it is, and you're like, I'm still not very clear, I'm still not sure, I think I want to go and think about it. Yes. So don't let's look at it as an eternal label. No. Okay. And obviously they'll be reviewed from time to time. There'll always be a constant review. Yes.
Yeah, just a quick one.
Sorry.
Carry on.
Sorry, thanks very much. I actually asked that question. My name is Obi. Thank you very much, Doctor. I've just got a few scenarios here, but just particularly regarding this. I know you did mention, you didn't specifically mention specific diagnoses. You categorize them under behavioral or emotional. Coach Sonia was aware of one instance with my son, which she helped me with. Well, like I said, that's what's triggered the question in terms of a teacher assumes something is wrong with a child, and then even before an official diagnosis, then within the school premises, within the school learning environment, there's that. I know you don't want to use the word label, but there's that kind of label already attached to the child, even before a formal diagnosis. You understand? It wasn't until I, as a parent, kind of like stood up after seeking help advice from Sonia, because she was teaching then. I saw through basically whatever Senko, whatever the Bible was put through, and discovered really it wasn't really of much help, other than the fact that it was just missing lessons because it was good at a particular subject. So it was missing that lesson. I just thought it was a way to kind of set him back. But then I made him go through it for, I think, a half term after a whole year, and then I pulled him out. The only thing I noticed was I just developed this confidence in speaking, but that was not the reason why they put him there. Now, that is just a one-off, and that's my own personal experience with my son. I wish you say my son now, but then now relating this to another child in the same school setting, secondary school setting, where this girl has actually been, I know we don't want to use the word labeled again, but labeled by the teachers, you understand? now knowing from what you've said now, it was actually behavioral, you understand? And then basically, when they're teaching, they give her like the less tasks to do, you know, like, yeah, she can't understand, as if she was kind of dyslexic, so to say, but that wasn't the narrative that was painted. And then they invited the parents refused to accept it, and then there goes the parents is living in denial, you understand? And then like the teachers have, is it like an overriding responsibility over the parents, you know? Unfortunately, the girl had an accident and was hospitalized. And while she was hospitalized, she had private tutors and all of that helping her. And basically, this is a girl that was told she wouldn't get anything done at GCSEs. Fortunately, well, like I said, unfortunately, she had the accident, but fortunately, in all of those private studies, this girl came out tops. Now, that's why I'm saying in terms of behavioral, could it be maybe the girl was going through some things at home, but that labeling when it starts from school, even before an official diagnosis, is something that stays on the record. And that's why I'm speaking as an African parent. When it comes to that, the first thing I want to do is not seek for help. You understand? I want to say, how can what do I do? Could it be this? Could it be that? Before I actually want to go out. The last thing I want to do is to go to a GP and say, I think my child has got ADHD. I think my child is this. I don't know if you understand my point. I don't know if that clarifies it for you. I'm sorry, I've said a lot.
Yeah, I understand what you're saying. And thank you for that example. And I would say that, you know, like I said earlier on, a lot of these words, these terminologies gets used quite loosely. And in that instance, I would say that, you know, you have a right to ask the teacher that, is there a formal diagnosis? Do you have anything to show, you see, for this? Because sometimes I've got young people who would need reasonable adjustments in school. And they would tell me that, the parents would tell me that unless they get a document, you know, a doctor confirming it, school is not going to give them, you know, what they are asking for. So in the same way too, a parent who has a right to say, you can't label my child as this until there's a formal, you see, until there's a formal diagnosis, until you can't sit, because the truth is, I don't, a patient doesn't come into my clinic and I just look at them and I say, okay, you've got ADHD, or you've got, no, because I have to do an assessment, and because I need to be able to back up what I am saying with the evidence, and the evidence is the outcome of my assessment. So we have a right, you see, to ask the teacher, is there a formal diagnosis? If that is what you're thinking and there's no formal diagnosis yet, then put me along the right path. Let's get a diagnosis, and please don't call my child this when it hasn't been, you know, when it hasn't been diagnosed. Yeah. Though sometimes they might think we're being, you know, it's being confrontational, but then it's part of your rights. If there's no formal diagnosis, then they shouldn't give a child or a young person that label.
Yeah.
Thank
you very, very much, Doc. If anybody have any question you want to unmute, just put your hand up. There's another question that, okay, someone has put their hand up. I will call you in a minute. Okay, I'll let you just speak. Please unmute and speak. Then I'll put it on later.
Thank you very much, Dr.
Yeah.
I love the fact that you said we should not be afraid to, you know, speak up what we believe, because most time African parents, most especially, we put our head down. We don't challenge when our children are being profiled, you know, profiling and be labeled. It might just even be a child just being naughty, and they put right there, they stigmatize that child. So that is why sessions like this are being held, for us to be informed. It's very, very good for us to be informed. I just love this session tonight. I wish I can allow it to everybody, and I'm going to share it to as many people as possible, because most time you see when people come with questions, you can just feel that fear from their voice. Some are so afraid. They are, they feel shame as well. You know, they feel that is their fault and all that. Is not your fault. You know, when Dr. Abby was talking, talked about that most of this child, some of them can improve, and those conditions with time, you won't even see them again. So it is not something, it is good for us to seek help as soon as possible. And while we are seeking help, let us get informed. Let's look at information. I've seen African parents as well. I don't know if it's because of our background. They tend to do this superwoman thing. You know, they are so stressed out. They are so filled with so much and they are not getting any support. Please let us reach out and get support. Thank you very much, Dr. Abi. Thank you.
Thank you, Adisa.
Thank you very, very much for that awesome submission. There's a question that said, I have a child that is very stubborn and easily influenced by others. Do you think this could be a mental health issue?
Right.
That's what happened. You're laughing. You're laughing.
Well, from what you said so far, I can't see anything that I'll pick out there and say this is a mental health issue. Now, we also have to look at it depending on the age of the child. You see, children and young people, as they grow, they experiment, they're inquisitive, they try different things. Your child will go to school and come back, and then you just hear a word and you're like, where did that come from? You know, so that's children. So and I think this is where we need to be patient. You see, we need to show them care, we need to show them love. And sometimes these behaviors you're talking about, it might just be a phase. It might just be a phase. So maybe it's good to find out, is there a new child in school? Has he or she changed their group of friends? You see, is there anything going on in school? Is there anything going on at home? You see, and I think a lot of us African parents, we come with even me sometimes, you know, I'm like too hard. And then I realize that, no, you know, that's not the way. Be calm and be gentle. You know, my child says something and I think he's used an offensive word. And the first thing is, what did you say? And then the child doesn't want to talk again, you know. But I've realized that is a very wrong approach. I'm not saying you should be like, oh, yeah, say it again. No, but you're like, I didn't hear you, you see. I'm not just like, oh, I did the tone of your voice. Oh, I didn't hear you. And then the child will say it again. And then you're like, oh, okay. I think we need to have a discussion about that, you know, what you've just said. So where did you hear it from? You see, in that way, it will be easier for the child to open up. I think those of us coming from African background, we have a lot of work to do, bringing up our children, you know, in this environment because of the way we've been brought up and because of the environments in which our children are. Well, I think if you permit me to say at this point, I think this is where sometimes we need a grace that is higher than us, you know, to be able to know what to say and how to say it so that we can get out the information we want and know how to use that information to help that child or young person and let them to know that, look, at the bottom of all this, there is love. And another thing I've also discovered is children, no matter their age, their race, or their color, every child or young person wants stability and consistency. So whichever way we're able to do it, when a child knows that his background is stable and consistent, then they'll be confident to say even the things that is, you know, troubling them.
Yeah. Thank you so much, Dr. Abimbola. I've taken you more than 34 minutes, more than the agreed time. Thank you so much for your patience. Thank you so much. You see, a lot more people sign up, and then this is the people that we have. The truth is, you see that stigma. When you are doing something on employment or you are doing something on money, you see, like influence of people. But when you are doing things on mental health, a lot of people kind of get stigmatized. But I'm really, really happy that more people are beginning to embrace the idea that we all have this mental health. However, the mental health issues is the thing that we're talking about, trying to draw people's awareness into. And you've done justice to that today with the questions. Parents, please be bold, be bold, be bold. Please watch out. I'm going to be doing a conference in November on positive intentional diaspora parenting. Dr. Abimbola said it. There are so many things that we didn't see. And also the way we parent as well sometimes okay, I'll ask the question. The way we parent sometimes do really impact our children. The way we're brought up with, sometimes we're brought up in fear. You don't want to do certain things, not because of respect, but because of fear. And we are then doing the same thing. to our children? How do we unparent ourselves? And how do we parent in a way that it will fit the digital children that we're raising up these days? Someone said, how do parents get EHCP? That's the Educational Healthcare Plan. How do parents get that?
So like I said, you can make an application yourself. If the child is in a school, you can ask the school nurse. If the child say, for example, like is a nursery, you can ask any of the people in nursery, or you can walk up to to any of the children's centers close to you and ask to speak, let to know when the health visitor would be around. Or you can go on the local government website, your local council website, and type in requesting and applying for an EHCP, and they should be able to put you in the right path. Or if the child is open to pediatrics or to CAMS, you see. So really, anyone can make an application for an EHCP. Yeah. It's just that the thing is they would ask for supporting documents, from any professional or agencies that's involved in the care of the child.
Okay, all right. Thank you very much, Abimbola. I don't want to take any much of your time. Tomorrow is Monday. I want you to go and support the children and have time with the family. So please say your thank you to Dr. Abimbola as we shut down in few minutes. Dr. Abimbola, thank you. God bless you.
Amen.
Thank you so much.
Thank you for having me.
I appreciate and honor your time. Right. Okay. So to everybody everybody's saying thank you to you. For everybody that have sign up and come here today, please do where to go on my YouTube and share this video to people. People need this information. We do share skits and everything to make us laugh. Let's do where to also share informative videos as well that will help people know what to do and do more. Someone said I have more questions. Don't be greedy now. Dr. Abimbola needs to go. What is the question? Quick. She needs to go.
Thank you very much. I know Dr. Abby is very busy. It takes up to about 6 months to get Dr. Abby. He's so busy to get our appointment list. Honestly, we don't know how blessed we are this evening. Dr. Abby, please, I just want to quickly ask. Most of our parents, that goes to church and they've got children with special needs. And when they are coming to church, most of them feel, they feel that the child might not be able to fit in or they are embarrassed. Is there anything that one can put in place in the church environment to make all our children comfortable and to support them as well? Because we expect them to be supported in school, we expect them to be supported in other environments. What about churches? What can we put in place to support our children?
Very good question, Adesua. Coincidentally, I'm on the Sunday schools, one of the Sunday school teachers in my church, and we do have 1 or 2 children with special needs. And we realized that, we can't ask them to go. They also need to hear, to be in an environment where other children are, when they come to worship. And what we did was we didn't really have a training, so to speak, but we just had a kind of like a mini training. Let me just say mini training, very informative. Got information from the parents, what helps the child. And then because quite a number of us have experience with with special needs. So we are able to, and God helping us, we're able to provide one-to-one support, you see, for the child. So I would say for churches, one, parents should not be afraid or feel stigmatized in taking their children, to Sunday school. I would say approach the Sunday school departmental lead, you see, and explain that this is what is on ground. Some Sunday school departments might have the resources to be able to provide one-to-one, some might not be able to provide the resources. But if the parents, if the Sunday school cannot provide the resources, I think it's just good for the parents, go with the child. So some of the children too, they actually started with their dad or the mom, sitting in with them. They have their own box of like their sensory box of the tools they use, and they sit with them. And bit by bit, as the child got more comfortable, you see, being in the setting, then the parents can leave, maybe like go downstairs, the class is upstairs, and then after a while, then the parents can actually go to the class, for the main service. And probably it might just be that you bring in the child once everybody's settled, and then you take the child just before everybody, before all the noise, and so I think the best thing is, don't shy away, talk to the Sunday school departmental lead and let them know that this is the needs of your child, and you'd like the child to be part of, to be part of it. And if they have the resources, they should be able to, to be able to provide the help. And learning about these things is not difficult, because of the world of internet now. You can go on the internet and read about all these things, and there's some agencies that would apply, that would give them free trainings, you see, that you can go on just to get equipped. Because I think that if other places with secular settings are putting in reasonable adjustments, to be able to accommodate the needs of these children and young people, how much more in a place of worship, you see, we should also be able to, well, having said that, if the resources are there. Yeah.
Dr. Abimbola, are you sure we're not going to have part 2 on this thing?
Thank you very much.
Well, I was going to say at this point that I think it will be, let's have we might be good for us to have a part 2. Otherwise, we will have an ending time. So
see, are you guys going to say thank you? Did you hear? Did you guys hear? Did you guys hear? You guys are not going to say anything. See, he said, sorry, one more. Thank you so much for this opportunity, ma'am. I just want to ask a question: how to help my child with cerebral palsy? Also, if social worker is not involved, what advice do you give in time of signing papers, what to do and not to do? Thank you, ma. That's the last one. I'm not taking another question. Sorry. Did you get that?
Say, yes, I did. So obviously, first of all, the school environment, is it conducive for the child? Did the school know about,
the child has not been put in school yet because they are new to the country and they are still doing assessments, since the child has not been in any school yet.
Okay, so in that case, any decision will have to be made after the assessments have been completed. And I would say be truthful to the social worker, or to whichever agencies is asking you questions as much as possible, you see. And don't let's not hide anything. Let's be truthful. That's one thing I've realized, if you're truthful, help would come. It might not come immediately, it might not come the way you want, you see, but at least, it's open to everybody, that this is the situation of things and you're not hiding anything. And if you think you also need to see the GP or you need to see a pediatrician, let them know. Let the GP can always refer to a pediatrician. And I would say, if you have any documents from where you're coming from, you see, make use of it. Yeah.
Yeah, sorry, I just wanted to quickly add to what Dr. Abi said. And I know Dr. Abi mentioned this earlier on. We have to be informed again that social workers have different roles. We have social workers that work with elderly. We have social workers that are in the mental health sector. We have the ones with learning disability, complex need, child protection, look after children and all that. So, but people then tend to generalize the word social worker and the label down, say that person is coming to take your child. When they say, if you have a child with special need and a social worker is involved, please, please, please don't hide anything. Work with that person. That social worker is there to make things easier for you, to help you to navigate one support or the other, to refer you to services that will benefit you, and to make sure that there is no career breakdown and your child receives every support that they need. Like Dr. Abi is here. I work with Dr. Abi and I know how, difficult it is for us to get up, because everybody wants like that expert opinion and all that when it comes to going to Dr. Abi. So if you have it, so he's there to support you. Please don't see it as a bad thing. Work with that person, open up and say the truth, please. I happen to work with complex need, learning disability, and I am there for those with that. Is what make my job worthwhile. Please, please, please don't hide anything. Just work with them. Thank you.
Thank you so much. Thank you. Thank you very, very much. Please, thank you. Dr. Bimbo, at this point, I think I'm going to have to smuggle you out of this place, because I don't understand. Is this smuggle or small? I don't even know, sir. Thank you so much.
Oh, you're
Right,
very
we're going to have to
welcome.
end this now. I think this is the longest webinar that I've had. You know, this is the longest. Please kindly share in your status, share to people. Let people get informed. Let people get support. Thank you all so much, Dr. Bimbo. God will bless you. Thank you so much. Enjoy the rest of your evening. Good night,
Thank you very much for
everyone.
having me. Thank you, everyone.